And I think we mentioned in the last episode that if you can give exosomes in the first week or two to someone with head trauma, it looks like you can dramatically change the outcome in terms of headache and problems with confusion and memory loss and sleep disturbance, all the things that happen after a concussion.
Welcome back to another episode of the Biohacker Blondie podcast, where we talk all things health, wellness, longevity, and of course, biohacking. I'm your host, Jenny Jones, and today we continue our in-depth conversation with the brilliant Dr. Sheldon Jordan. If you tune in to the first episode, we covered a ton of ground, from advanced brain scans to treatments for cognitive decline, but we still have so much more to discuss. In this episode, we're diving deeper into some fascinating topics: how an unhealthy brain looks versus a healthy young brain, the role of brain fat and supplements, devices for optimizing brain health, and strategies for managing pain. Dr. Jordan has seen it all through his extensive work with patients and advanced imaging technology, so his insights are truly invaluable. So without further ado, let's jump right back into another amazing episode with Dr. Jordan. This program has not been evaluated or approved by the FDA. The comments within this presentation are not to be taken as advice or treatment for any condition or disease and are being presented by the purposes of discussion and education only. Please consult with a qualified healthcare practitioner before making any changes to your health or pursuing any new treatments. Okay, so we are back with Dr. Jordan on the Biohacker Blondie podcast, and I thought we covered so much on the first episode, but I have so many more questions. There's so much more to get into the looks of an unhealthy older brain versus a healthy young brain, brain fat, brain supplements, devices, pain management. We're going to get into so much more. So another episode is here, and welcome Dr. Jordan to the podcast. I'm so excited again. Thank you for taking the time out of your day.
Nice to see you, Jenny. Let's do it.
So let's get into the questions. We'll just get going because there's so much to discuss. I'm curious, since you've seen so many scans, what does an unhealthy older brain look like when you look at scans?
Well, it depends if you're looking at a routine scan, like an MRI scan, or if you're looking at some advanced imaging. And so I'll make a little bit of a distinction. Okay. With classical standard imaging, you can look at the shape and size of the brain. That's the main thing that you can detect. And you can see if something's shrinking or if something has some damage in it, like a scar. And one can see if there's any evidence of any blockage of some of the major spinal fluid pathways. So, and of course, if there's a tumor, for example, one might pick that up. But it would take advanced imaging on an MRI machine to really look at how the brain is functioning. So it is now possible nowadays to look at brain function, not just the shape and size. So we can look at how one part of the brain connects to another. For example, we can look at the memory center and see how it connects up with the rest of the brain in order to do its job. We can look at the circulation in the brain, whether or not the small blood vessels are delivering blood on demand like they're supposed to. And we can look into brain chemistry. So if there's some problem with the mitochondria, the fuel-producing components of cells, we can detect whether or not the mitochondria are functioning properly or not. We can look at the presence of inflammation in the brain. And interestingly, we can even look at the drainage system in the brain. So if there's clogging up of the drainage system and you're developing toxic buildup, that can be measured. And there are lots of other things like how the different parts of the brain connect to one another. Is there a breakdown of some of the networks? And those may be networks that have to do with insight, networks that have to do with memory. And we can start to look at the neurochemicals that are required, so-called neurotransmitters. We can see what neurotransmitters are lacking or not functioning like we expect. So there's a lot of material that we can look into besides just the shape and size of the brain. We can really look how the brain is working in an individual or not working in an individual. And once we find out which system is failing, the beauty of all this is that when you can identify that there's a problem, let's say with vascular or inflammatory or mitochondria, then we don't have to guess. We don't have to guess about which supplements, what medications, which therapies are going to be necessary to optimize someone's brain.
Wow. Okay. I did not know if we can know all that information from a scan.
Well, nowadays that's where this is going. It's not just about the shape and size anymore. Now we can actually look into the functioning, and it's in our experience this has been very informative in determining what is the specific therapy that an individual needs. It takes a lot of the guesswork out in our experience.
Wow. When did this scan become available? When did people start?
Well, functional imaging and some of these other imaging modalities, I would like to use the term advanced MRI imaging, has been developing, I would say, over the last 10 or more years. And we've been working on this material for over 10 years in combination with UCLA and Harvard in developing a very robust platform of different modalities that can be applied to a given individual. Everything can be done within an hour. We don't typically have to inject any contrast. And we can get a lot of material and compare people with themselves, compare people with normal folks. So it's all done statistically. And we found it to be very useful in determining what systems are failing, coming up with a very specific plan for treatment. And also it's been useful in tracking outcomes once they've had a particular kind of therapy or not.
Wow, that is so amazing. So typical people that do this test, are they coming to you because they have a lot of brain issues? Or do you also see people in the longevity space saying, hey, I just really, CEOs saying, I want to optimize my brain?
Well, both. And frankly, Jenny, the way that you're posing the question, it sounds like there's a big distinction between normal and abnormal. But really, I'll tell you that a lot of folks come to us concerned about what happened to their parents or their grandparents, and they saw how someone's brain was starting to break apart, let's say in their 60s, 70s, and 80s, and they're coming to us in their 40s, 50s, and 60s, and they're asking the question, can you identify problems that distinguish me and maybe are predictive of what's going to happen 10 or 20 years from now? And not only what it predicts, but does it give me some insight into what kind of potential intervention might make a change in my outcomes?
Yeah. Would you recommend exosomes that we discussed in the last episode for, kind of everyone for their brain health?
Exosomes for their brain health. Well, this is something that we're looking at in the future, of course. I think right now this is part of clinical trials, so it's not the kind of thing that we would recommend for everyday administration. But I think that's where we're going. There are certain circumstances where people have an acute injury. For example, we're doing a research project with head trauma, and I think we mentioned in the last episode that if you can give exosomes in the first week or two to someone with head trauma, it looks like you can dramatically change the outcome in terms of headache and problems with confusion and memory loss and sleep disturbance and all the things that happen after a concussion. We believe that we can change that outcome. It's a focus of research that we're doing, but this is very exciting. And I think what's going to happen in the not too distant future is that people are going to get a head injury, let's say playing football. They'll go to the emergency room, they'll get a dose of exosomes, and that'll be the end of the story.
This is so cool.
Right now, we hold them out of play for several weeks. We wait until the brain tries to recover. And as you're probably aware, some people don't recover very well. They may have lingering injuries that can go on for many, many months or permanently.
Yeah, maybe some blood flow or different that can impact the brain and cause permanent damage.
But exosome delivery for other conditions such as Alzheimer's disease and Parkinson's disease and aging and resetting the aging clock, I think this is something that you're going to see coming online in the next several years. Our initial experience has been very interesting, and we're really looking forward to working this out further and making it available for people. And it's not particularly expensive type of technology. The way that we're designing it, it could be done in any clinic setting. We're seeing the glimpses of something that's going to, I think, change the aging process and change the process that relates to Alzheimer's, Parkinson's disease, and other aging-related conditions.
Yeah, I've seen, people with Parkinson's, Alzheimer's, and all they want is to have basically their brain back so their body can function, so they can do the things that they used to do. And that's the sad part, is when your brain starts to have these issues, you're not yourself, So, but let's talk a little bit about Alzheimer's, because I know a lot of people are dealing with that. And we didn't talk about this last time, but I know like the plaque buildup is definitely a topic most people go to when they think of Alzheimer's. And then they had that medication come out, which there was some gray area about that medication, I believe. So what is the future for Alzheimer's? What does a brain look like that has Alzheimer's? Where do you see plaque? And is that the main issue of Alzheimer's?
Are you ready to take control of your health and weight loss journey with real science-backed support? Introducing Mochi Health, a fully virtual platform that connects you with board-certified doctors and registered dietitians for a personalized weight loss plan. With Mochi, you'll have access to FDA-approved medications like GLP-1s, including Ozempic and compounded versions, delivered straight to your door. But that's not all. They offer more than just medication. Their holistic approach includes expert consultations, nutritional guidance, and even sleep therapy to ensure you reach your health goals sustainably. And the best part, it's affordable and accessible. Whether you're using insurance or paying out of pocket, plans start at just $79 per month, making it easier than ever to access comprehensive obesity care. Ready to start your transformation? Visit joinmochi.com and use the code BLONDIE, BLONDIE, for $40 off your subscription. That's Blondie for $40 off. That's joinmochi.com, where science meets personalized care for results that last.
Well, there are many things that happen with the condition that we call Alzheimer's disease, but let's talk about some of the main features. So we know that there is a buildup of a particular plaque called amyloid, and amyloid probably in part is a reaction to challenges that the brain may have. For example, if the brain is exposed to certain kinds of pollutants, or if it's exposed to certain chemicals or toxic proteins or invading microbes of various sorts, the amyloid gets produced, and it acts as sort of like a fly trap to kind of stick together and keep some of these invading elements kind of stuck together and not in a position where they can damage the brain. So just to some extent, amyloid production is a response to a challenge. Unfortunately, the amyloid itself appears to be inflammatory. So you're trying to stop an invasion of one sort of thing or another, and the consequence is sometimes more of an inflammatory response.
Mm.
There's another protein that gets developed called tau. So tau protein is also something that can happen in the setting of an inflammatory insult, and that can build up and cause damage within cells. So the amyloid kind of develops on the outside of cells and produces damage to the surrounding milieu, but also inside cells, the tau can accumulate. And the real problem is both of these substances have a way of propagating. So little bits of it can be transmitted to different parts of the brain, and they incite additional buildup of the same kinds of proteins. So they act almost like a virus.
Wow.
So they use the term prion-like, which almost has virus-like qualities that as it spreads, it also propagates and proliferates, so that you get a spread of pathology around the brain. So starting in one area and traveling to other areas.
And that's why you just see someone, you see like the initial signs of Alzheimer's, and it just gets worse quickly. It just like, kind of.
Because over the years, these plaque and the tau tangles is what they call them, they build up and they cause more and more damage to normal cells. They disrupt the signaling characteristics between cells, and you start losing your personality and your functionality. All the intricate networks that are necessary to make you who you are, they're slowly pulled apart by these processes. So the idea has been to try to produce medications to take away some of these amyloid deposits, and they're studying also ways of taking away these tau deposits. But it looks like there's a lot more that needs to be done, really, to turn things around. There's more and more interest with these endogenous viruses that are called human endogenous retroviruses, and there's another element called line 1 transposons. I know those are also big words, but let me see if I can kind of summarize that. It turns out that we have these ancient viral particles that are actually integrated into our genetic code.
Mm.
So only 1% of your genetic code actually codes for you. The other 99% is something else, and a big portion of that appears to be related to ancient viral infections that have gotten into our genetic code. And those get activated at different times in your life. And as they become activated, they're very inflammatory. So to some extent, the amyloid that we're talking about and the tau that we're talking about, in part may be a response to the activation of these ancient viral particles that are part of our genetic code.
Do you think that's part of the aging? Like they're there because we're supposed to have our biological clock, and they're well, at certain times.
So, Jenny, you're bringing up a very, very interesting topic, and that has to do with how our milestones in our life are generated by our genetic code. So, what you may or may not remember is that the difference between mice and chimpanzees and humans is very little in terms of the genetic code. The vast majority of our genetic code is shared equally between those creatures, and yet we're very different.
Mm-hmm.
And part of the reason why we're different is because we have these other elements that control exactly how the genes are expressed. So when we have these ancient viruses that have gotten attached to our genetic code, they change the timing and the extent of genetic expression. So, for example, one of the very last viruses that got into our genetic code appeared to have occurred when the chimpanzees and the humans branched off of the primate tree. So we're talking about many millions of years ago. And so these agents aren't necessarily all bad. They do have something to say about the way we develop normally.
Mm-hmm.
The problem is these viral elements, when they get activated during milestones in our life, they can become prone to misbehaving when there's an inflammatory signal in your body. So let's say let's say you're a teenager and your emotional maturity, your social maturity is dependent on the activation of one of these ancient viral elements. So it
Mm-hmm.
turns on that social maturity component that's required in your brain. There are
Mm.
different parts of the brain that develop during that time frame.
Yeah.
But at the same time, if you're exposed to an inflammatory challenge, these viruses start propagating. They start making elements that are very inflammatory, and then you can start someone into a very destructive cycle, like, for example, depression. Like, so you ask the question is, teenagers go through a normal development, but why do they run into problems with suicidality and depression during those ages? And
Yeah.
why later in life can they become schizophrenic? And even later in life, you can develop Alzheimer's disease. It's because different viral elements are turned on at these different life milestones, and they are available for attack by various kinds of influences. So, schizophrenia, for example, happens when our frontal lobes, one of the last major developments in our brain, develops in the 20s, right? And so the transposons that are required to produce your frontal lobes are generated and exposed during that time frame in your 20s. So if you have an inflammatory signal that is able to now interact with that exposed transposon, you can develop into a schizophrenic-like condition as opposed to a normal adult.
I never even thought about this, but what triggers like puberty and menopause? Like, yes, our hormones change, but yeah, what is triggering that? Is it viruses?
Well, there is a biological clock,
Yeah.
and you're presumably in the hypothalamus, which interacts with different parts of your body that controls when you turn on and when you develop into certain characteristics.
Mm.
And it turns out that this part of the brain is largely responsible for coordinating the aging process. So there was a very interesting experiment that was done at Albert Einstein by Dr. Kai and his colleagues. He found out that if you go into this hypothalamus, which is in the middle of the brain, and you immunologically destroy this little lining cell around the hypothalamus, a mouse will immediately turn old within a matter of a very short time frame, days, weeks. Their hair falls out, they become cognitively demented, they become sexually inactive, their muscles are weak, their bones are fragile. All the trappings of aging happens in a very accelerated time frame. On the other hand, if you take that same animal and you now give them exosomes, little particles of stem cells from a young mouse, they stay young.
It's insane that that one part of the brain controls your body.
Well, there's a central clock. People like to talk about peripheral clocks, so each cell in your body can
Yeah.
kind of wear down and become old. But there appears to be a coordinating mechanism that I would like to call a central clock that kind of puts everything together.
Yeah. And I have to say, when we met, I thought you were in your 50s. So I
Well,
guess that 20-year reverse of.
I reset my clock. We talked about that. So if you can take young exosomes and deliver it to this hypothalamus, which you can non-invasively using, for example, ultrasound, focused ultrasound energy.
Mhm.
You can point that through the scalp at the hypothalamus while you're getting young exosomes intravenously. That'll make the exosomes actually adhere to the hypothalamic clock, and it can reset it. And that's what I've done for myself.
I don't know if I asked this
I'm actually
last.
70. I'm almost 75.
I know. I was really shocked So were you always looking like this, or did that reverse the look of your age?
Well, I'm starting to wear down a little bit, so I'm ready for my next dose. Let's put it
Okay.
that way.
Would too, any age. Make me a baby. No?
Well, I don't think you necessarily want to be a baby again, but you definitely want to have your health. And I think this is something that's going to happen as a routine.
Yeah.
Obviously people are interested in cosmetic surgery and looking healthy from the outside, but how about improving your muscle? How about improving your sleep quality? How about improving your drives?
Yeah.
So all those things are actually encompassed in the hypothalamus, and they can be reprogrammed.
I'm so excited. I can't wait for this
This
to
is obviously all research, so I'm not going to say that people should like run out tomorrow and get this done. But this is very exciting, and I think this is a big area where the field is going to be going.
Yeah, I'm super excited. Can't wait to try this. I love trying things out, so I'll be the guinea pig. So let's get into a little bit of pain management as well. How it is when someone's struggling with pain, is there something that they can do for the brain to get rid of that pain? I know that's a huge issue for people that struggle and they're on pain medication. And there's so many, side effects to pain medication. And is there anything that we can do to maybe just flip a switch in the brain or wear a device or something to get rid of that pain management?
That's a great question, Jenny, and I think that this is an area of active research, and I can't say that we have a perfect answer to that yet, but we do have a number of clinical trials to look at different areas of stimulation. So we've talked about focused ultrasound. Um, Transcranial magnetic stimulation is another technique that can be used. And we've used these kinds of techniques, as have others, in controlling pain. And I think that right now we can see some results using these kinds of technologies aimed at different targets in the brain. So far, the results have been interesting, but not particularly durable. And I think finding exactly what's the right target, exactly the right dose, I think those are things that are still being looked into now. So, for example, many people have worked with magnetic therapy of the motor cortex, and that seems to have at least temporary benefit. People have looked at the frontal lobe and have treated that, and certainly the depression that people get with chronic pain can be treated with this target actually very nicely, and sometimes that'll help the pain as well. But I think there are deeper targets that we're interested in going for. So the thalamus, for example, um, we have ways of imaging chronic pain with our advanced imaging initiative. So we know where the pain can be seen in the brain. You can actually see people in pain in our experience,
Wow.
and we know which pathways are involved. And I think we're right at the point where we're developing some studies to go after these different targets in the thalamus. We think that that's the way to go. Now, that might be standalone therapy, just using the ultrasound to fix it. Like I said, people have using transcranial magnetic stimulation on the scalp, which doesn't go very deep, but it can get some of the cortical structures involved. And that's been sort of okay. People have tried it. Um, Much better for depression, not as good for pain so far, but it's an area of really active research. And I'm gonna go out on a limb here, and I'll say in the next couple of years, we'll figure out which thalamic target and which dosage is required, and we're going to do a lot better in terms of controlling pain. I don't think we're there just yet. There are a lot of other ways of treating chronic pain. Obviously, people have used stimulators and regenerative techniques,
Hmm.
of course, medications, but as much as possible, we would like to get people off medications, like particularly the opioids, and see if we can use these kinds of techniques instead.
Yeah, I think that's definitely a huge issue and it would be life changing for so many people. And it's from our brain, right? Our brain is active, like noticing that pain. Isn't that what like ibuprofen does? Is it takes away that, I guess, the transmitter, I don't know, of pain
Well, Jenny, I'll say this. In our experience, when people say they're in pain, we can see it
in the brain.
in the brain. Yeah,
Mm.
and I think that by and large, I know that there's a lot of discussion about how much people complain of pain just so they can get drugs or
Mm.
just so they can get something else, and they can
Yeah.
use the pain as a way of getting things done. And frankly, that hasn't been my experience in my practice and in my experience. I think most of the people that we see, at least, when they say they're in pain, we can see it,
Yeah.
and I think we can go after it. I can't say that right now we're as successful as we have been with other types of things, like helping memory,
Mm-hmm.
helping a movement disorder with Parkinson's, helping tremors, shaking, helping anxiety,
Mm-hmm.
helping depression. I think these are all things that are, in our experience, relatively easy to treat with focused energy of various types. I'd have to say that there are two things that remain somewhat elusive, and I'm not going to give up until we do a better job. So one thing is chronic pain, and the other one is obsessive compulsive disorder.
Mm.
There are these folks that are plagued by recurring thoughts and recurring compulsions that kind of waste their bandwidth, and they can't really get on with all the things they need to do for life. And I think we're on the verge of having something available again with ultrasound, standalone therapy with ultrasound. We can get at some of these targets. We can certainly see with advanced imaging, we can see what networks are involved with obsessive compulsive disorders.
Well,
So we know we can identify it, we know we can target it. We just have to figure out what kind of focus energy will do the best.
yeah. Yeah, it's not, I'm sure it's definitely complicated to some extent.
No, but Jenny, we're going to get there. I remember when I was a resident many years ago, um, one of my mentors said that in his lifetime, he's going to see a cure for multiple sclerosis.
Wow.
And I'd have to say that when I was a resident, people had multiple sclerosis. They pretty much ended up in a wheelchair and they were very disabled.
Mm-hmm.
Um, what I can say is over the course of my career, it did, unfortunately, for Dr. Rose, who made that statement, he passed away before we really could come up with a good treatment. But I have to say that most of the time when people come in with a diagnosis of multiple sclerosis, nowadays there are so many things that we can do that changes their outcomes dramatically,
Mm-hmm.
that it no longer is the scourge that it used to be where people ended up in a wheelchair all the time.
Yeah. Yeah, I definitely think there's so many things that are happening in the health industry you know, of brain health, physical health, there's stem cells. It just goes on of what's happening, and it's happening quickly. And then there's gene therapy and so there's so much that's going to happen, I feel like, in the next 5 years, where a lot of our health issues hopefully can be relieved.
Well, I think people have sort of taken a fatalistic view of certain conditions. Like if they get Alzheimer's disease, it's not just a quote natural consequence of aging, or if they get Parkinson's disease, that's what you get when you're an old person. And or schizophrenia, it's bad
Yeah.
luck that you have this condition, or autism, it's maybe not reversible. But I think more and more we're getting a handle of all these different conditions and realizing that we can make a difference. I was really struck, many years ago. We're going back to like around the year 2015. So, talking about more than 10 years ago. Um, we used a repurposed cancer drug for treating patients with Parkinson's and Alzheimer's disease. And we
Oh.
found out, and we published this, of course, but it turned out that 40% of the individuals got substantially better by an entire dementia scale level. So going from mild dementia to not demented, or going from moderate dementia to mild dementia, that happened 40% of the time. We never imagined that these conditions were actually reversible. And I think that's really got me onto my present venture, which is to follow up those amazing results, that we don't have to be fatalistic about any of these conditions. I think we're within grasp of making a big difference in these conditions that we thought were inevitable problems that end your useful life. I'd say at this point, we should be able to turn these things around.
Yeah. And then we have, I guess, AI, which hopefully, will help and personalize everyone's health issues by bringing more and more data, and then it can spit out the best solution for
Well,
everyone.
we already use AI a lot. I think when I have a problem that I'm not familiar with, there are various kinds of AI engines on the internet that can help me get my reference material up to date very quickly. That's really, I would have to say, in the last year or two, that's made a dramatic improvement in my ability to take care of really challenging situations. But just the ability to get your hands on data quickly
Yeah.
has really accelerated. That's already made a big difference for my patients.
I know. I feel like it's amazing how quickly you can look up. I mean, it researches, I guess, everything on the internet and just spits it out in 2 seconds. It really is amazing. So yeah, so are there going to be drugs for Alzheimer's? Is that something that is in the works as well?
There already are.
Yeah.
There are three drugs that have been approved by the FDA in the past couple of years. The first one was aducanumab, then Leqembi, and then donanemab. And Leqembi and donanemab are on the market, available, and that's certainly something to consider. They do have certain side effects. They have about a 30% incidence of brain swelling and bleeding.
Mm,
Most of the time, it's not particularly dangerous to the patient, but it definitely is something that has to be used very carefully. It does look like you can slow down the worsening rate in patients, so that's kind of interesting to have a couple of agents that are available. However, there's numerous other agents. Some of them are in the category of supplements that have been shown to be beneficial. I would say
for
one
all.
thing that I can think of right off the top of my head would be trimiprazate. So trimiprazate, also known as homotaurine, actually has a series of research studies that have looked into the potential benefits for individuals with cognitive impairment, and it looks very exciting. Now there's a company who's picked up on that and is making a drug which is kind of built on that molecule that looks like it works. It's actually passed its phase 3 trial, and it probably this year it'll come out as a drug that you can buy, and it's fairly, hopefully, will be fairly inexpensive, and it's relatively free of side effects, and it may turn out to be better than some of these agents that are already on the market, and you might be able to use them in combination to get the best outcomes. We'll see. But there are many other drugs that have been looked at that actually have benefit, and it's shocking to me that a lot of practitioners don't seem to be up to date in terms of what's already been published.
Yeah, I knew there was one medication that came out, but the side effects or the swelling, it's kind of seems risky. So
Well, yeah,
it's
there's a quote of something like 30% risk of bleeding and brain swelling, but most of the time it just has to be observed. You don't have to stop therapy for most of them. And they do a great job in terms of getting rid of the amyloid plaque, which we were talking about earlier. So it's extremely effective in that. But what we recognize is the amyloid plaque is only one element. There's multiple things that have to be taken care of. But this is, look, it's moving the process forward. And I
Yeah.
think in a very short time frame, we're only probably talking about the next couple of years. I think you'll see people starting to combine therapies and getting much better outcomes. We know that there are certain supplements like the plasmalogen precursors, which are kind of similar to the omega-3 fatty acids. I know you had a few questions to talk about that later in the session,
We could
but
talk about it now.
okay. But I'm just saying that that's an example of something that could be an add-on.
Yeah.
Melatonin, making sleep better, exercise, the trimiprazate that we talked about. There are
Thyroid.
other agents that look like they play a role, and I think as doctors start integrating all these different elements together, I think we're going to see a much better outcome.
Yeah. I'm I started taking, L-tyrosine. I found out that that's the precursor for dopamine, I believe.
Right.
And yeah, it's preventative for Parkinson's because Parkinson's is a sign like a deficiency of dopamine, correct?
That's no, that's right, and people are doing exactly what you're talking about. But there are also herbs that are available as supplements. So Mucuna pruriens is an herb. Say that 5 times fast.
I know.
There is
What?
so Mucuna is a Mucuna is an herb that has these kinds of agents incorporated into it, and some people who are interested in natural sources might do that before they take a regular medication if they have a mild case of something that looks like Parkinson's. Um, but that's the kind of thing you can discuss with your doctor and see if that's something that's worth considering. But yeah, I think there's a lot of things that are already out there that are helpful, and some of them are supplements, some of them are herbs, some of them are medications that have been repurposed. So rapamycin is maybe something that maybe you've heard a lot about. So rapamycin has been used in this realm of um, slowing the aging process, and people are also using it in the setting of some of these aging-related conditions, including Alzheimer's disease. And when given in small doses, it's relatively inexpensive, relatively safe. A lot of people have been using it. It's approved for other purposes. In full doses, it's approved for transplant rejection treatments,
Hmm.
like if you get a kidney transplant, for example. But in lower doses, it turns out that it seems to be beneficial, and people have been using that now. We need more study to really prove that it does what people say it does. But like I said, it's relatively inexpensive, relatively free of side effects, and people are working with some of these medications from the standpoint of repurposing. So I did research with a drug made by Pfizer called bosutinib, and we published on this in 2017, I think, the first time. But it's a cancer drug that we use it in lower doses, and it appeared to turn on the natural disposal process. So we talked about these proteins like amyloid and tau that build up the central nervous system.
Yeah.
Well, part of what you want to do is prevent the production of those proteins, but the other thing we want to do is accelerate the disposal, right? So you
Hmm.
can work on the disposal end of things, and that's what we were doing. And that's where we found that 40% response rate, which was really quite remarkable. We didn't even expect that.
Wow. And I didn't even think, I know with rapamycin, and I know like Peter Attia has been on it for 6 years and says he doesn't feel a difference, but he's taking it because it's known like it for to reduce age. But yeah, I didn't think about, do you see anything with brain health or like difference in the brain with rapamycin? Is that something they're researching as well?
I don't know if there are ongoing clinical trials looking specifically at rapamycin right now. I
Okay.
know that there are actually many individual doctors who have been incorporating it into their anti-aging program, including individuals with aging-related degenerations like Alzheimer's disease. It's fairly safe. You can take it once a week dosing, low doses.
Yeah.
I have some patients on it because they're interested in getting on it.
Hmm.
Um, it's obviously not approved for treating Alzheimer's disease. I mean, we should be
Yeah.
pointing that out. And does it really work? I don't know, but it seems to be safe. I think there are other things that we have investigated that clearly showed some improvement. We were talking about this plasmalogen precursor, which is similar to
Yeah.
the omega-3 fatty acids. So there you can show, even in a relatively short time frame, you can show people getting better in terms of their energy, their focus, their cognitive um, performance. It can change things around very quickly.
Like a simple supplement. And with these, so no one knows about plasmalogens. It's a very new topic that I've mentioned to a few people. And everyone thinks, okay, omegas. What is your opinion on taking either both, taking just plasmalogens? Do we need both? And I kind of wanted to also talk about brain fat. So I think,
Well, this is a part of brain fat. So
yeah,
this brings up, the general topic of brain fat. And as you're aware, Jenny, your brain is more fat than it is water, I think. There's at least a lot of fat in there, and the type of fat turns out to be very important. And so the story that's relevant to this whole topic has to do with what makes up the membranes of every cell. So if you can think of a nerve cell, it has an outside lining, which is the membrane, right? And that membrane is made up of fat. And for the sake of argument, let's talk about two main fats that float around, cholesterol and plasmalogen. So if you think of it this way, is that the membrane has a certain degree of stiffness, and it has to have just the right amount of stiffness to be able to function. So among other things, a nerve cell has to be able to make bubbles. At the synapse, the neurotransmitters are encased in little bubbles and then released at the component called the synapse, right?
Yeah.
So a little bubble filled with neurotransmitter gets released, it acts on the next cell in a chain, and that produces the communication. So it's a chemical communication. But to be able to make that bubble, you have to have exactly the right flexibility of the membrane. And you know that this is true because you've blown bubbles ever since you were a child, right? You have to get just the right concentration of soap and water to be able to make a good bubble, right? That's what it's all about. So you have to have the right ratio of cholesterol, which makes the membrane too stiff, and plasmalogen, which makes the membrane a little looser. So you want to get the right balance between the two of them. When you get it right, the nerve cell can produce this little bubble and it's be able to communicate. If it doesn't have enough plasmalogen, it can't make these synaptic connections. You then can't transmit a signal from one nerve cell to the next nerve cell in a chain, and your brain power starts to fall apart because your networks are dependent on these connections. So it's that simple. Now, when you take an omega-3 fatty acid, that does not have all the components you need to make the membrane function correctly. There are, now, that's not to say that fish oil isn't healthy for you, but to help the brain function well, you probably have to take enormous doses. And I'm going to give you a number, which people may argue about this, but I'll say it's 4 grams a day. And I would tell you that if I took 4 grams a day of an omega-3 fatty acid, I would be belching all day long. I would be bloated, I'd be belching, I'd be feeling sick. It's a lot of oil, right?
How many pills is that typically? Like if you get an omega-3 supplement?
Well, people can take it as a liquid or they can take it as capsules.
Yeah, how many?
But that's a lot of oil, and a lot of people will really have a hard time digesting that. On the other hand, plasmalogen gives your brain what it needs, and it has the omega-3 fish oil, like the DHA is one of the major omega-3 fatty acids that you need. That's attached to a glycerol backbone. That's what makes up these plasmalogen precursors. So you're getting everything your brain needs. You're already getting the omega-3 fatty acid. So do you also need the omega-3 fatty acid? Then you have to have a conversation with your cardiologist, because there's a particular ratio of EPA and DHA that the cardiologists like to have for vascular health. So then the discussion is, how much EPA, DHA do you need while you're taking a plasmalogen that has the DHA already attached to it?
And you can test this as well.
So I don't take any extra EPA, DHA, omega-3. I just don't take any of that. I just take a plasmalogen precursor.
Okay. Is there a brand that you recommend if people want to go find, or just research?
Well, the company that's done the most work on this that I'm aware of is Prodrome Sciences. So Dr. Goodenow has done research over decades looking at these materials, and he sells a plasmalogen precursor, which I take, and my experience in deploying this in probably over 1,000 patients at this point is that most people recognize some improvement in their focus and memory even after a week of taking it.
Wow.
I notice it myself, and if I don't take it, I definitely notice a difference. So that seems, and we did a research project with Dr. Goodenow that demonstrated some benefit in a small trial. He did a very, very large epidemiological study with it was either Rush or Northwestern, but one of these Chicago institutes. He did a very, very large epidemiological study, and he found out that if you're lacking this particular fatty substance, it turns out that your risk of Alzheimer's goes way up.
Wow.
And very interesting, and I think this is spectacular in the epidemiological studies that he did. It looks like one of the major risk factors for getting Alzheimer's disease is that people don't have the right chemicals that are necessary to transport extra cholesterol out of the membrane. So they use the term reverse cholesterol transport. So there's something called ApoE that is responsive. It's a lipoprotein that is responsible for transporting cholesterol. And it turns out that when people have the wrong genetics and they make the wrong ApoE, so they have ApoE44, there's a very high risk of getting Alzheimer's disease. But if you take the extra plasmalogen precursor, you can neutralize that risk substantially. And I'm going to get back to the bubble blowing to explain that. So what cholesterol does is it makes the membrane stiffer. If you have the ApoE44 genetics, you don't have the protein that takes out the extra cholesterol. So when you have too much cholesterol, the membrane's too stiff, it can't make these bubbles. So the way you can try to get around that is to change the ratio of cholesterol to plasmalogen by taking extra plasmalogen. And that's why you can reverse the extra risk, because you're trying to restore a normal balance in the fatty makeup of the membranes in the brain,
so that your neurotransmitters can function correctly.
Well, you can't package a neurotransmitter if you can't make these synaptosomes, which are the bubbles. If you can't make them, you can't have a normal communication in your brain, so everything starts to break apart.
I am ordering those today.
But there's another piece of, so we're talking about fat in the brain. So there's the other piece of this is the type of fatty acid that is provided by the plasmalogen precursor, or if you're going to take omega-3 fatty acids, you have to take enough DHA. There has to be enough DHA because the DHA is a natural anti-inflammatory component. So if you can get that into the fats that make your membranes, then you can neutralize inflammation. And it turns out a lot of these aging-related diseases have to do with too much inflammation.
Yeah.
So you need the DHA in your system to be able to neutralize inflammation. And if you don't neutralize inflammation, then your mitochondria fail, the internal workings of your cells fail, and you get premature cell death.
Mm.
And if you kill enough cells, then you can imagine the clinical manifestations are going to be something like a dementia.
Yeah. It's much easier to prevent than try and reverse.
Right. And so what you can do nowadays is these fats can be assayed. You can get blood tests to figure out exactly what you're lacking and what you need to get extra of. So if you don't need extra fatty acids to supplement what you got, maybe your diet is good enough, maybe your genetics are perfect and you don't need extras. But if you're lacking, we can check it. I don't like to guess at anything. Right?
Yeah.
So we can measure it. It's not expensive to do. It's a simple blood test.
Yeah. Yeah. I know. It's like, and you can go order it now. You know, there's places online, there's Function Health. They will test your omegas and the ratio and everything. So there's so many ways out there to just do a quick test. And a lot of people shouldn't be guessing, especially, and when it comes to supplements, I think most supplements, you should do your blood work, do your tests and figure out what you're deficient in, what you might have too much in.
Or if you have toxins, so there are a lot of things that people do that they think are healthy end up being more damaging than they ever imagined. For example, depending on where herbal remedies are sourced, they can be laced with very high levels of lead.
Mm-hmm.
So if you're taking herbs, perhaps periodically you should be checking for lead. People like to eat sushi. I like to eat sushi. But at some point, my mercury levels were off the charts because fish, unfortunately, depending on the type of fish you're eating, can have very large levels of mercury. So you think you're being healthy by not eating fatty red meat, or you're trying to cut back on the carbohydrates. So you eat more fish, you think that's going to be healthy. Well, you better be checking and see what the outcome is going to be. And people want to get away from gluten, for example. So a lot of people are gluten sensitive. So they start eating rice. Well, it turns out that rice that's sourced from certain places like India have extremely high levels of arsenic.
Yeah.
So when I check heavy metal screens in some of my patients, we start seeing all of these toxic elements that have built up that they never imagined. They thought they have a really, quote, clean diet and they're eating really healthy, and it turns out that they're poisoning themselves.
Yeah, I know. It's a whole thing where it's like, how often should I be testing for mold, heavy metals, and all these toxins? Because it happens a lot, and people have skin issues, mental issues. Even the heavy metals can cause pain, and so these toxins can be the source. And we should always be, I think, testing these maybe once a year.
Well, also, you're bringing up one other topic, and that is even the food you eat. You don't know what your sensitivities are unless you test it.
Yeah.
People can be sensitive to coffee. They can be sensitive to, I don't know, potatoes. They can be sensitive to chicken. It's like you think you're eating healthy, and it turns out you might be uh, taking in substances that you're very sensitive to, and that worsens your inflammatory response. That actually ends up doing more harm potentially than good. So I think the other thing that people have to do is figure out like what diet is actually the right diet for them, because everybody's different, and you can't be guessing at this.
I know. And I think there's so much out there to also, eat this type of diet, eat this type of diet. And there's so much based off of your DNA, your genetics and everything of also how to eat, what are the best foods for your body. Everyone's body's different. I know like Mark Hyman has so many patients where it's like some do very well on keto, some do not, then you start having cholesterol issues or everything. So, what diet works for someone definitely might not work for you. So, and it might do wonders for them, but not for you. So everyone needs to keep that in mind.
Yeah, well, I think what we're saying here is get a baseline testing.
Yeah.
Um, Try to develop a very personalized system that makes sense for you, and then measure the outcomes.
Yeah.
See if it actually is able to perform in the way that you hope. And this is particularly an issue for gut health.
Mm-hmm.
So people take probiotics and they may not take.
Yeah.
And maybe you need to do more than that to actually accomplish anything. And so, just taking one test at the beginning doesn't, and then you go on a particular kind of diet and probiotic, maybe yes, maybe no. I mean, you need to be figuring out if you're actually accomplishing anything.
I know. I like to retest as well. Like I've been, deficient in iodine, selenium, and then I retest and I'm like above. So, and you don't want to be, you have to be in that range because you don't want to damage your body too by,
Right.
overdoing it. So it's so important to do your lab tests. What are your top supplements you recommend? Do you also recommend magnesium? I know that's another one, for our neurotransmitters. There's the fat. So, is that something? Do you recommend a specific magnesium or just a blend of all of them? Do you typically?
Well, let me make an initial comment about strategy, and then we can talk about supplements. So, as I've said on several occasions, I don't like to guess at anything. So, I think what you do is get an evaluation of what your needs are. I like doing these advanced imaging tests of the brain to see exactly what the brain does or doesn't need. Uh, Whether you need to have support for mitochondria, whether you need support for inflammation, the vasculature, lymphatic drainage, and so on. So I like to be very specific in finding out, because as a neurologist, I'm interested in the brain. I think that if you're going to look at systemic health, there are some panels out there that are in some cases direct to consumer laboratories where you can do like a finger stick test and get an idea about what's going on. And I'll just mention one type of laboratory would be Ginfinity. So
Mm.
Ginfinity is one laboratory. You can take a finger stick, and they'll give you a panel that shows how you're doing in terms of your mitochondria health, in terms of inflammatory substances, so you can get an idea of what may or may need to be done. Now, this is particularly important for choosing supplements that have to do with mitochondria, because you can make a list of 20 things just for mitochondria.
Yeah.
Think of all the things: coenzyme Q10, NAC, NAD, glutathione, uh, resveratrol, alpha lipoic acid, L-carnitine. You go down the list, before you know it, you've got these many supplements that you're going to take all day long. You got to have 50 supplements just for your mitochondria. So, like, why don't you find out what you need? You might not need everything. My idea is to be as precise and personalized as you can possibly make it before you start venture, because you can spend a lot of money in these supplements and spend a lot of time,
I
and
know.
you may not need them, right? So my thought process is, let's be as precise and personalized as you can to start. Now, having said that, I'll tell you some things that very frequently come up in individuals. First of all, inflammation is very common.
Mm-hmm.
If you want to say one thing that is common to most people who are aging, is they have excessive inflammation. And that's because many things cause that. There's a change in the mixture of bacteria in your gut, so-called dysbiosis. You can have a leaky gut. You can have senescent cells, so old cells that are breaking down and giving off inflammatory signals. You can have um, sugar-like molecules attached to the proteins in your body, glycated proteins that can be inflammatory. So you can go down the list: chronic infections, CMV, EBV, Lyme disease, so all these conditions that you develop as you get older produce an inflammatory process which basically tears down your body. So what can you do to minimize inflammation? Well, it starts with diet, right? So there's certain dietary sources that are more inflammatory than others. So we have the sense that we talked about the fatty acids before, and there are certain fatty acids that promote the development of arachidonic acid that are so I think the precursor is linoleic acid. So my understanding is you find that in corn and soy. So you probably think about your diet first is how can you cut out the inflammatory components that are in your diet. I think the last episode we talked about how you cook your food. So if you brown your food, the browning process produces something that is intrinsically inflammatory. So you want to do more steaming and boiling and that sort of thing. Maybe eat things that are raw, or if that's safe, depending on what you're eating. So the idea is it starts with your food, like minimize the inflammatory signal that's coming from your food. The second thing is getting deep sleep, not just sleep, but deep sleep. Getting that 1 hour of deep sleep is absolutely critical because when toxins build up in your central nervous system, it's the deep sleep that allows your system to get rid of the toxins. So that's very important. Now, in terms of supplements specifically, I find a lot of people would probably benefit from taking, if you're going to take it as an omega-3 fatty acid, you want to make sure you get the EPA-DHA, or you can use the plasmalogen precursor from Prodrome Sciences that we're talking about. That is a very common one that people will take. A curcuminoid in one form or another may be very helpful. And I think a lot of people would be very savvy about curcuminoids. So that's related to turmeric, the spice. So the active agent in there, which is a very profound anti-inflammatory, is curcumin. And but the idea is how do you get curcumin in your system because it's not very well absorbed from the gut. So some people take black pepper with it, and the idea is that may increase absorption. But there are also medications or supplements that are on the market that are better absorbed. An example would be Theracurmin HP. So that's in a lipoprotein formulation. It allows the curcumin to get across the gut barrier better. There's another prodrome product called Prodrome BDMC, which appears to get absorbed pretty well. So curcumin can make a big difference in terms of your aches and pains and back pain. It can get into the brain. There are studies that have looked at this for brain applications as well. So I think a lot of people would benefit from a curcumin related extract. I think plasmalogen precursor and or omega-3 fatty acid would be two things that most people would benefit from. Vitamin D. A lot of people are deficient in vitamin D because they don't get enough sun, and I appreciate that because they don't want skin cancer. So they slather themselves with SPF 50, which I think sucks the pigment out of your skin. But and then they stay out of the sun, which is good for your skin, but you need that vitamin D production, so you may be lacking that. Getting enough vitamin C, which you would get from citrus fruits. Sometimes people don't get enough of that, and that's helpful for maintaining a good biome. And magnesium you're bringing up. So magnesium is something that has a lot of uses, and I take it myself, frankly, and I think it's a good thing for a lot of folks, perhaps over age 40 or 50, to take. It helps your gut motility, which is good. It
Yeah.
helps minimize cramps, which a lot of people start to get in
Yeah.
middle age. It has some benefit in migraine prevention.
Mm-hmm.
I'm thinking 500 milligrams a day of magnesium. Take it as the glycinate or the gluconate, because if you take it as the citrate, it causes too much gut irritation, too much diarrhea. So I'm not uh, really recommending that unless you're so constipated you need it.
Yeah.
But I'd say for a regular day basis, the glycinate or gluconate magnesium formulation would be great to take, and I take that myself. I think butyrate is an interesting thing that you can almost do no harm with that. So take it as the calcium magnesium butyrate.
Hmm.
So butyrate is a substance that's made by healthy bacteria in your gut, and for whatever reason, if you don't have the right mixture of bacteria in your gut, the butyrate prevents leaking of your gut.
Mm. Which is a huge issue. I think most
Huge,
people.
huge issue. So leaky gut, think of whatever's floating around in your bowel movement. I don't think you want that floating around in your bloodstream or getting into your brain, right? I mean, just think of it for a minute. That's enough. You don't have to think anymore.
I think it's happening a lot. A lot of people have leaky gut, and that's going right into
So
their.
butyrate is the thing to take. So calcium, magnesium, butyrate. Take 1 or 2 capsules a day. Now the whole here there's a little trick to taking this though. It smells like week old gym socks. You want to put it in the freezer or in the refrigerator at least. And if you do that, it'll minimize the smell involved. It really smells pretty bad. Uh,
I smelled it and I thought my supplements went rancid.
no, that's
So this is good.
I can imagine if you're not used to it, you might say that. But now that I've given you that gym sock idea, it'll probably click. And I think yeah, just put it in the refrigerator or the freezer, and that'll make it much less
That's great.
onerous. Yeah.
So which
So those are the main things I think of B vitamin. I think if you're gonna take a B vitamin, take it as the active methyl form.
yeah,
So there are several companies that have the methyl formulation of folate and B12.
yeah, which I'm taking now
Yeah.
because of the MTHFR gene.
Melatonin is the other thing I'll bring up. 'Cause
Yeah.
you're bringing up a wish list. I'm getting too many supplements here, but it's probably a count of 10 now. But so melatonin, everybody should be taking, and I'll tell you why. Melatonin is not just for sleep. In fact, it may not even work for your sleep, but don't worry about it. It is one of the best antioxidants. It also stimulates your immune system. So it has effects that are above and beyond maintaining sleep. It is probably the main product released from your pineal gland. And in everybody, your pineal gland runs down, calcifies, and becomes inactive. So by decade, you make less melatonin. And that is probably absolutely critical for maintaining the youthful performance of the biological clock in your hypothalamus. So the pineal gland sends the melatonin forward into the hypothalamus and keeps the hypothalamus acting young. If you take away the melatonin, the default mode is to grow old. So you have to have melatonin added to your diet.
Wow, I knew the pineal gland, but I didn't know that
Well,
those.
that's it. So the pineal gland is it does other things. There are other hormones that are released from the pineal gland, like epithalamine, for example. But melatonin may be the most important. And and if you want to take epithalamine or these other ones, you can, they are available as supplements. But I just take melatonin, and I take it at night. I can only tolerate a certain amount because I feel too sleepy the next morning if I take more than 3 milligrams.
I'm very sensitive.
Yeah, so 3 milligrams is probably the lowest pill size you can get, but find out what dose you need because everybody's different. But take as much as you can tolerate. If you're feeling too tired the next morning, you've taken too high of a dose, just cut back.
Okay, that's great advice. I have another quick question that someone also mentioned. They did a test and they don't have as much, I guess, blood flow to the brain. I guess they saw Dr. Almond, did a scan, found out he had, not enough blood flow, thinking hyperbaric oxygen chamber. What do you recommend when someone does a scan and they don't have as much blood flow as they should to the brain?
Well, there's lots of options here. So when I do hyperbaric oxygen treatment myself, I feel much more focused and alert. Um, Not that I'm in a semi-coma now, but I definitely feel some buzz from it.
Yeah.
So it does seem to have some benefit. I don't think that benefit is particularly long lasting.
Mm.
And I think people will get into these, regular doses that they have. So they'll go to a service that they get, or they may get a home unit. So I think there's some benefit to it. Um, I I don't think that that's something that I would rely on. I think that that's something that's part of a comprehensive program. And there are many, many things that you can do to improve uh, blood flow to the brain. Many. So one thing is there's a beet extract
Mm.
that is available that is called Neo 40. And that's that. What that does is improve nitric oxide production. Um, and I'm not sure exactly what it is about beets that does that, but apparently that improves nitric oxide production. And nitric oxide actually opens up the blood vessels to deliver more blood. Now, in worst case scenario, we'll actually use something like Cialis or
This-
Viagra. So these are agents that initially were studied for treating hypertension.
Mhm.
They dilate blood vessels, and they work for improving the tumescence of the penis because they increase blood flow to the penis, which obviously has an advantage under certain circumstances. But it appears to affect the body as a whole. So that's something that we'll sometimes use in individuals who have problems with their circulation in the brain. Obviously, if they have hypertension that's not well controlled or diabetes, those all have to be dealt with in some
Yeah,
fashion.
I know even the bacteria in your mouth,
Oh,
your
that's no, Jenny. That's great. I'm glad you're bringing that up. That is a very important topic. So people will use antiseptic washes or antiseptic um, toothpastes,
mm-hmm.
and those can kill off the healthy bacteria in your mouth. That is a problem because it turns out that the ability to make nitric oxide is dependent on certain bacteria that lives in the crypts of the back of your tongue. So there's a particular species of bacteria that is necessary, and apparently they're required to make 80% of the nitric oxide in your body. We're so dependent on, 80% of the neurotransmitters in your brain have to do with the normal bacteria in your gut,
Wow.
and B12 have to do with the normal bacteria in your gut. Well, it turns out that nitric oxide, we're dependent on these bacteria that live in your mouth. So when you kill them off, you're dramatically changing the physiology of your blood vessels. So I think the take-home lesson there is don't use toothpaste or mouthwashes that are bactericidal.
Yeah. And a lot of people do not think about that. And I've heard, one guy said he stopped using the mouthwash. His blood pressure was up, went down. He could tell, I guess, with the genitals, a difference as well. And so by just getting rid of the mouthwash, and then he added some beets and spinach to up the nitric oxide.
Yeah, and the beets. So that's Neo 40 is a beet extract. That's what that is.
Mhm.
And there are other beet formulations that you can get on the market. So the Neo 40 is kind of nice because it's just a lozenge. It's easy to take.
Oh,
But
yeah.
there are other formulations, and you can of course eat beets.
Yeah. Yeah, so these are, and I think the hyperbaric oxygen therapy might help a little bit, but you're right. These other factors can really help produce blood flow. So I didn't even think of.
Yeah, look, I'm not an expert in hyperbaric oxygen. I wish I knew more about it. Um, but um, and I think that I need to learn more about it myself. But one thing a little concerned about is if you increase the oxygen levels in all the tissues, including your gut, what does it do for the bacterial mixture in your gut? So
Mm,
some of the normal constituents of the gut are actually anaerobic, so they live best in a low oxygen tension environment. So when you increase oxygen, what do? I don't know. Um,
that's
and
a really good point. I didn't even think of this.
and I don't know what it does to your lung tissue, for example, when you're exposed to repeated high doses. I'm not saying there's anything bad here. I'm
Yeah,
just saying that I'm not an expert in the long-term consequences of hyperbaric oxygen, but in the short term, I feel great when I do it. A lot of my patients want to try it, and I say, great, do it. But I don't know if we know exactly how to optimize it and what the real limitations are in terms of long-term therapy.
yeah, I didn't even. Those are great questions. I know a lot of people love it and they get a lot of benefits. It's really good for after surgery or something, and it helps.
Well, healing wounds,
Yeah,
phenomenal. Yeah.
yeah,
So if you have a bad open wound that's not healing well, it's amazing.
yeah,
If you had a recent surgery and you want to get that wound to heal fast, it's amazing. No question about that. But
yeah.
I think Jenny, you're bringing up a different issue here, which is like, how do you use it effectively for aging and for aging-related conditions? And I think at least in the short run, it can be beneficial. I just don't know if this is the kind of thing that you want to do on an everyday basis. I really don't know.
That's a good question. That brings up something that I think needs to be looked into more. I know we're kind of going over time. Is really quick question. With COVID, I know a lot of people lost their sense of smell and everything, and I know that's directly goes to the brain. Have you seen the effect on the brain from COVID? And is there anything we can do to maybe help that part of the brain that was affected from COVID?
Yeah, thanks for bringing that up. So, I have to say that it's almost every day I see a post-COVID individual or a post-COVID vaccine individual.
Every day?
Virtually every day I see a new patient that has become a victim of exposure, whether it's the COVID itself or COVID vaccine. These things are very inflammatory. We talked about inflammation as playing a very important role in a lot of these chronic conditions,
Yeah.
and having that spike protein in your body is highly inflammatory. And these vaccines, among other things, create the ability to make more spike protein. And the idea is that that was a good idea because you would now make antibodies that neutralize it. That was the whole idea. But the Titanic was a good idea until it wasn't. And, it turns out there are consequences to exposing the body to spike protein that wasn't really anticipated.
Mm-hmm.
And look, I think we've saved a lot of lives, probably, with the vaccine. Um, and we've probably minimized a lot of disease that could have been a lot worse. So I really don't know where we would have been without the vaccine. So, I'm not here to be an anti-vaxxer, and nor am I a pro-vaxxer. I just think when any new therapy comes out, there are risks and benefits, and I can tell you that there are risks that weren't particularly expected, and we have a lot of people running around who are having the aftermath of being exposed to the vaccine. Plus, we have a lot of people who have had COVID and they're having problems. They're having loss of smell is bad enough. Now, thank goodness, most of the time that comes back. But there are a lot of people who are left with this chronic fatigue syndrome, inability to concentrate, disrupted sleep, disrupted mood regulation. Um, it can be extremely disabling, and I see it on a daily basis. Now, thank goodness there are some things that seem to make a difference. And I'll tell you some of the things that we've worked with, and we've had a lot of experience with this actually. So one thing is this is an immune mediated post-COVID condition. So there's an inflammatory reaction that is responding to this challenge, right? So the immune system is called into play, and you start making inflammatory reactions that don't seem to shut off. So there are two kind of mainstays that we found to be effective for many of our patients. One is immunoglobulin infusion. So it's what we call IVIG. So intravenous immunoglobulin. So that can be effective as a treatment. Another treatment that we've used is to just filter out the blood, something called plasmapheresis. So plasmapheresis can take out some of these toxic elements that are floating around in the system. So those are two things that have really shown a lot of benefit in our experience. Now, these are obviously off-label applications of these two. Getting coverage is, I can tell you, is quite a chore. But we have had a number of patients who have been able to get access to these therapies, and we've seen what we think are some really great responses. Now, there are a lot of other things that people have tried. Now, some of these inflammatory supplements that we've talked about, of course, we would try those. Sometimes that helps.
Yeah.
Very interestingly, COVID can change the gut biome. So if there's a dysbiosis that's a consequence of COVID, we can try to change that. And that's a combination of prebiotics, probiotics, and maybe other interventions to work on the gut. So that is something else that we may work with. If there are other inflammatory factors that we can work on, but also some of these supplements like the plasmalogen precursors, the curcuminoids, we can try to work with some of those agents. So one way or another, knock on wood, we've been mostly successful in helping people get better, but it isn't necessarily easy. And there are a lot of people affected. It's quite a legacy of this epidemic that we had. And we're also concerned that there have been some long-term consequences, and we haven't seen all of that yet. So after the original flu epidemic, I think from 1917 to 1919, that original pandemic, I think they call it the Spanish flu, if I'm correct. So that flu, of course, made a lot of people sick, but there were consequences neurologically that showed up later, like Parkinson's disease and prolonged severe encephalitic conditions. So I don't think we've necessarily seen the final story written yet for these patients. I'm here to try to pick up the pieces when they start falling, but I don't know if we've seen the end of this epidemic and the consequences for the population as a whole.
Yeah, I'd even think about the long-term effects that maybe we haven't even seen yet, which is scary for sure. Because I've seen both. I've seen people, with the vaccine, and then also it had COVID. It's just been, even my mom, has leg pain she never had before until she got COVID, and
well, they can get a damage to their nerve endings, so they can get an inflammatory immune-mediated neuropathy, and that's one thing that can respond to immunoglobulin therapy. So that's a possibility.
I know I've taken immunoglobulins as a supplement, but I didn't even think of an IV. So
we're talking about high doses of human purified immunoglobulins, very expensive therapy. So you really need to get your insurance company to buy into it. Otherwise, it's not even practical. Same thing with plasmapheresis. These are not cheap therapies.
30,000 or something.
You're looking at numbers, in the many tens of thousands. That's correct.
Yeah, so definitely it's not really, a lot of people cannot afford that. So yeah, so those are such great options. I didn't even think of those two. Maybe take some immunoglobulins as a supplement. I know that also might help with your immune system and everything. So
Well, you can take bovine
colostrum.
immunoglobulin, right, which might be helpful for you have these refractory dysbiosis where you've tried probiotics and you've tried prebiotics and you've added vitamin C and zinc and vitamin D and you're still not having the right kind of GI tract, then this is something that can consider.
No, yeah. Quick one, just if you can spit out really quickly any lab tests you recommend for brain health. I know probably like cholesterol or something, but just a few, maybe 10 lab tests that they can just.
Well, I'll tell you what I look for in a panel is first of all, I like to look for chronic infections, so CMV, EBV, herpes, Lyme.
Mm.
I think that would be important. I like the Ginfinity panel, their SOS panel, so that gives you a measure of mitochondria, glycated proteins, and inflammatory factors.
Oh.
I like the Prodrome Neuro profiles, so they can look at all the fats that we're talking about. You can look at that.
Mm. This is great.
I just absolutely love the KBMO test. So the KBMO test is a finger stick that looks at gut leakiness,
It's
and
on.
it shows all the food allergies that you might not be aware of. So that's a wonderful test to do. So I rely on that on every patient.
Wow.
Um, and I think people need a toxic screen. Definitely the heavy metals.
Yeah.
Um, Now, routinely getting mold, I don't necessarily do that. I think if someone has a mold exposure by history, I might try to track that down. But I think if you do that without a clear-cut mold exposure, you're going to find a lot of false positives that may not be actually all that informative. Because a lot of people have been exposed to food that have mold in it,
Mm-hmm.
or they've been exposed in the environment, but it's not necessarily causing trouble.
Mm.
So I don't necessarily get mold on everybody, but I don't know if I'm missing anything. Those would be the main things that I would be looking at. Depending on the case, I might get a test for the biome.
Mm.
Now, this is important to recognize that very recently the government has done an evaluation of a sample of biome tests of stool, and they found that they're not accurate. They're not accurate between tests, and they're not accurate between comparison with a gold standard. So I'm there's only one company that I use, which is Progenobiome for gut and for mouth, and I'm really getting away from other
Full test.
companies out there because I'm really not confident that the reliability and validity is there.
That's interesting. I didn't even think of that. But yeah, and it's also, with a stool test as well, it's like you have to get different sections maybe. I mean, it gets a little, how specific are they, because it can't be as accurate, or even also like maybe the next day is different or something.
Well, Jenny, I think there's an important concept that we're bringing up right now that I would really keep in mind for all of your viewers, is that some of the tests, some of the supplements, some of the peptides that are being used in a health program may not be validated.
Mm-hmm.
And many of them will have a disclaimer that a particular product or a particular test has not been approved by the FDA, and that it's not designed to diagnose or treat any disease or condition. And take that warning seriously.
Yeah.
That if the FDA hasn't really tested it out, it may or may not be accurate. So I think the next thing you have to do is, are there any publications in high-end journals that have demonstrated the validation of a particular product line? And if it hasn't, I'm sorry, excuse me?
Where would people go to look all this information up?
Well, you can see if things have been published in major journals. If a particular supplement or a particular test has been published in a major journal, and it's been validated against some gold standard, then you can maybe put a little bit more confidence in it. I think when it comes to supplements, there are third party companies that can assay them, and I think the way that I look at this as a consumer and as a doctor, I don't run my own lab, right? So, and patients certainly don't run their own lab. So there's no way that you can figure out if they really have what they have and whether they have contaminants in there, like whether it's arsenic or lead or mercury, right? So if you don't have a government watchdog like the FDA on your side here, and you're flying by the seat of your pants, like how do you biohack this in a way that actually makes sense? I mean, it's one thing to be out there in front, but you might as well be out there in front with good science. And so if there's a third party assay that's been done for a supplement or for a test, I would definitely choose that. If you're choosing between one company's product and another company's product, and one has third party validation and the other one doesn't, it's an easy choice for me.
Yeah.
And a lot of this gets lost in these beautiful websites and brochures and amazing talks where people can be very convincing. And I think a sophisticated consumer has to know how to be confident that what they're doing actually makes sense.
Yeah.
So again, if something has been published and utilized in, like, I've published in like Nature, which is the best scientific journal out there, or something's been in New England Journal of Medicine, or it's been in JAMA or some other high-end paper, then maybe you can put a little bit more credence in it. But if something has been merely published in someone's white paper and published online in some website that they control, I don't know if that is a level of evidence that would make me feel very comfortable.
I know. And you almost have to be a detective when it comes to supplements and do so much. And so many people are not, and they just go buy supplements wherever, not thinking about their omega-3 supplements, even their protein powders, and, can be contaminated with heavy metals. So it's definitely, and if you're going to ingest something every day, especially if you're taking a supplement that you're taking in every day, or a protein powder you're taking every day, you should make sure that it's third party tested. It doesn't have the heavy metals, because it's just something daily you're taking in your body.
Listen, 100%. I think that, for example, I like to have like one cup of coffee, and later in the day I'll take a cup of tea. And, I researched all these teas around the planet.
Wait, tell me which one you go to, because
no, but so I was particularly interested in a particular components that are in black tea that are supposedly good for brain health and longevity, right? And this is like a long topic we can cover at some point. But so I researched all these different teas around the planet, where they're grown and which has the highest concentration. But then I realized the same tea that I liked, that had the best concentration of this particular element, also had extremely high levels of lead.
Oh,
and It turns out in China, as an example, they burn a lot of coal, and the coal that they burn has lead in it. So the
Uh,
lead gets into the atmosphere. You have rain that gets it out of the atmosphere into the ground and groundwater. The tea plants then are going to be raised, and guess what's in the tea leaves? Lead.
wow.
This is the same thing with rice. So oh, herbs from India. This has been known about for a very long time. People love these different herbs because they have great qualities. And I look, I get it. There's some herbs that seem phenomenal. I mean, we were just recently talking about that mucuna pruriens for Parkinson's disease, which is an herb, right?
Yeah.
So, well, what if this isn't particularly true. I'm just giving this as a hypothetical. What if you also found out at the same time that that particular herb source is laced with arsenic? You wouldn't want to take it.
Yeah, I know. And so I think the soil and the water, like I know specific water from Mexico is highly contaminated. I won't say the brand, but so these things, because they allow the chemicals or the coal or these situations that end up in our water and our soil, which ends up in our food system. So it's so important but now we just have to be a detective. It's like
Well, well, look, Jenny, even sourcing your food, and this is something I'm very passionate about because I like to imagine myself as a sometimes chef. But I'm very concerned about how the food is sourced. So imagine you take a beef stock and you raise it on a prairie, and so they're eating grass. But in the last 3 months of their life, they're stuffed in a pen together with lots of other cattle. They're given hormones and antibiotics. You have to give them antibiotics because they're so closely stuffed in together. There's stool all over the place, knee deep. So they don't die of diarrhea. You got to give them antibiotics, and then of course you want them to fatten up, so you give them hormones, and then you're feeding them corn and soy
yeah.
because those are the products that'll fatten them up in that environment. So now you have inflammatory fatty acids incorporated into their tissues. It's laced with hormones and antibiotics. Plus, the animal is probably immensely stressed out in the last, several months in their lives because, after all, they're designed to roam, and now
Yeah.
you've made them prisoners for three months. I mean, is that really something that's going to be healthy to eat? As opposed to cattle that's truly raised on grass, free roaming until the day that they're slaughtered,
Yeah.
right?
Yeah.
So I think that's a very different kind of meat that you're going to be eating. Now try to source that. It's not easy
I know.
because you go to your local grocery store. I won't mention names right now, but you go to your local grocery store who they may promote themselves as being healthy alternatives to your regular, grocery store, and they don't even know how the meat is finished.
Yeah.
They say pasture raised. What the hell does that mean? If it's pasture raised, but the last 3 months of their life they're being fed corn and soy, antibiotics, I don't care how if they were on the prairie 3 months earlier.
I know. And then a lot of people just would look for cage free and think and so it's like you have to know all these things and find the best source. I know there's a lot more options in LA, Los Angeles over here than maybe compared to other places in the US or around the
Well,
world.
if you know who the producer is for everything that you eat, going from the fruit to the vegetables to the meat to the fish, I mean, it's a lot of work to do that,
It is.
and maybe that's an impossible task. Uh, but I learned this lesson from Thomas Keller that you may have heard of him. He's a very famous chef that has the French Laundry in Napa Valley, and he has a very famous restaurant in New York as well. And uh, I've had the opportunity to talk with him one on one,
Uh,
and I was just really struck of the degree of detail that is required to make sure that what you put on the table is actually healthy food. I mean, he goes out and he meets the farmers that are raising cattle and the ones raising lambs and sees how they're cared for.
Wow.
I mean, I think you want to eat meat that was cared by an animal that was taken care of in a loving fashion as opposed to someone who's penned up and tortured.
Oh, for sure. Yeah. But I'm sure he has to do a lot of, investigating to make sure that all those fruits, vegetables, and meats are produced without.
Yeah, but it takes a lot of work, and I'm not sure there's a central repository you can go to as an expert to know, what to buy. And of course, you can't always believe what people tell you. I try to source a lot of my stuff from the local farmers market,
Yeah.
and I'm just shocked at how little the vendors really know about how the food was produced.
Yeah.
They don't know if it was sprayed or not sprayed, or what fertilizer they used or didn't use. You just don't know. You really don't know what you're eating, unless you grow everything yourself, which clearly is not possible.
Yeah.
But homegrown tomatoes, they don't even taste like tomatoes I buy in the store.
I know.
They actually taste like tomatoes. It's a completely different vegetable.
I know. I don't even want to think about it. Or you go to a different country and it's so much more flavor, or so, go to Italy and taste the tomatoes there. So that our food doesn't taste right sometimes, and how it should taste. So, and which definitely affects our physical and our mental, like affects our brain, which it's so important. So it's like I try to reduce as much as I can. I'm not going to be perfect, but I definitely try to buy organic, try to find 100% grass-fed meat, or, do the things I can to reduce any of those toxins. Because I feel like right now we're just surrounded by so many, and we have to be very careful if we want to live like a long, healthy life,
100%. I agree with you entirely.
Yeah.
But it's not easy, and I look. I think your viewers have a hard task, which is trying to sort through all the PR, all the
Yeah.
marketing, and really get down to things that they can really trust. And it's not an easy task. And I think at some level, you just have to take the leap of faith, which, like I said, I hate guessing, but sometimes you really don't know.
I know. And then even if you're traveling too, it's like you don't know. It's just so it's a definitely a more difficult environment to stay healthy, So I love the future of everything we have easy access to, but it comes with the cons of chemicals and plastics.
Well, I think we spoke about plastics and microplastics in the last episode, but yeah,
No.
I don't know if you want to get me started on that one.
Well, I think you're doing amazing at almost 75. So, this is great advice for everyone, because if they want to look as good as you and have your brain, stay away from these things and be preventative, and then also, do the things that will promote, a healthy brain. So, anyways, but thank you so much for coming on the podcast. Where can everyone find you? Do you have a clinic in Santa Monica?
Yeah, so my main clinic is in Santa Monica. We're in the process of developing clinics various places around the world and
Amazing.
around the United States. But my main clinic is in Santa Monica. We do the advanced imaging here in California, and if you look up just Sheldon Jordan, they can find me on the web, and we have several companies that we list. The Regenesis Project, which is a research organization. We have about 40 ongoing clinical trials in Alzheimer's, Parkinson's, autism, a variety of things. And there's a book out which is called Regenesis, A Brain Doctor's Guide to Health. I think a lot of things that we touched on are in the book. It's kind of a fun book. People really like it. You can get that on Amazon. Um, and there are a lot of talks that I'm giving around the world. So keep your eyes peeled. Uh, I'll be soon at a forum near you.
I know.
And
Is there like a Brain Health Summit?
there is, well, there is Radfest is coming up here in
Yeah.
Southern California in September. I'll be on the main stage there.
Oh,
And
amazing. Okay, I'm definitely
and
going.
and for those doctors involved, A4M, I'm usually involved in their neurology programs. So, I have a lot of talks I give around the country, and I think if people, want to have a Zoom consultation with myself or one of my staff members and um, kind of get an education about what's available for a particular condition. You don't necessarily have to leave your home. I'm licensed in several states, but I think if it's purely an educational conference, you can pretty much do that as a Zoom almost anywhere.
Okay, that's great. So people can just do a virtual if needed, if they
Yeah.
can't maybe leave or something.
Yeah, I can't practice medicine in all 50 states, but there are a number of states where I do have licenses. But I think if people have some questions, and it's really for educational purposes, and then they can get things deployed either by coming out on a later visit, or I can put together, some possibilities that their local doctors can deploy potentially. I mean, those are all things that we do because we see patients from literally all over the planet.
Wow, that's so amazing. Yeah, I hope you make clinics all around the world, teach other neurologists and doctors about all this so that because you can't just do it all. Um,
Yeah.
so, well, thank you so much for coming
All right,
on the
Jenny, it was really, really nice talking with you, and let me know how I can help further.
Okay, thank you so much.
All right, bye-bye.
What an incredible conversation today. I hope you all found Dr. Jordan's insights as eye-opening and invaluable as I did. From groundbreaking brain health advancements to actionable tips on supplements and lifestyle changes, there's so much we can take away to optimize our health and longevity. If you're curious to dive deeper into any of the topics we discussed, make sure to check out Dr. Jordan's book, Regenesis, A Brain Doctor's Guide to Health. And as always, continue following the Biohacker Blondie podcast for more discussions like these, where we explore the best ways to biohack your body and mind. Stay healthy, stay curious, and keep biohacking your life. Until next time.